Insomnia. It's a word that evokes frustration, exhaustion, and a longing for restful sleep. Insomnia is more than just an occasional bad night. It's a persistent struggle to fall asleep, stay asleep, or both, leading to daytime fatigue and impaired concentration. But there is hope. STILNOX, known generically as Zolpidem, is a medication specifically designed to address insomnia's challenges. This guide will walk you through the intricacies of STILNOX, empowering you with the knowledge to make informed decisions about your sleep health. We'll cover everything from how it works, to potential side effects, and essential precautions. Let's delve into the science behind STILNOX and how it interacts with your brain to promote sleep. STILNOX belongs to a class of medications known as non-benzodiazepine hypnotics, often referred to as Z drugs. These medications are specifically designed to treat sleep disorders like insomnia. Unlike benzodiazepines, an older class of sedatives, Z drugs like STILNOX offer a more targeted approach to sleep enhancement with potentially fewer side effects. STILNOX comes in two forms: immediate release and extended release tablets. The immediate release form helps you fall asleep faster, while the extended release version helps you stay asleep longer throughout the night. Your doctor will determine the most suitable form and dosage based on your specific sleep patterns and needs. STILNOX works by enhancing the effects of a neurotransmitter called GABA in your brain. By increasing GABA's effectiveness, STILNOX helps quiet the racing thoughts and anxieties that often keep us awake at night. The result? A peaceful transition into sleep and a more restful night's sleep overall. To truly grasp how STILNOX works, we need to delve into the fascinating world of neurotransmitters. These chemical messengers are the communication network of your brain, relaying signals between nerve cells called neurons. GABA, as we've learned, is a key player in this network, responsible for inducing calmness and sleep. Think of your brain as a bustling city, with neurons firing like electric circuits. When it's time to sleep, GABA acts like a traffic controller, slowing down the flow of neural activity and creating a more tranquil environment. STILNOX enhances GABA's effectiveness by binding to specific receptors on neurons, much like a key fitting into a lock. This binding action amplifies GABA's inhibitory effects, further reducing neuronal excitability and promoting a state of relaxation conducive to sleep. However, it's crucial to remember that STILNOX is designed for short-term use. Long-term dependence on any sleep medication can disrupt your brain's natural sleep-wake cycle, making it harder to achieve restful sleep without medication. Determining the appropriate dosage of STILNOX is not a one-size-fits-all approach. Your doctor will consider various factors, including the severity of your insomnia, your age, weight, overall health, and any other medications you might be taking. It's essential to follow your doctor's instructions carefully and never adjust the dosage without their guidance. For adults, the typical starting dose of immediate release STILNOX is 5 milligrams for women and 5 milligrams or 10 milligrams for men, taken right before bedtime. The maximum recommended dose is 10 milligrams per day. Your doctor may gradually increase your dosage based on your response to the medication and any side effects you experience. The extended release form of STILNOX, typically taken once daily, also requires careful dosage adjustments based on individual needs. Your doctor will determine the most appropriate starting dose and monitor your progress closely to ensure the medication's effectiveness and minimize the risk of side effects. Remember, open and honest communication with your doctor is crucial throughout your treatment journey. Section 5. STILNOX and age dosage considerations for seniors. As we age, our bodies undergo various physiological changes, including how we metabolize medications. This is particularly true for older adults, who may be more sensitive to the effects of medications like STILNOX. Therefore, dosage adjustments are often necessary to ensure safety and efficacy. For elderly patients, especially those over 65, the recommended starting dose of STILNOX is typically lower than that for younger adults. This is because seniors tend to metabolize the medication more slowly, leading to higher concentrations in the bloodstream and an increased risk of side effects. Starting with a lower dose and gradually increasing it, if necessary, allows healthcare providers to monitor the medication's effects closely and minimize the risk of adverse reactions. It's crucial for seniors to be aware of potential side effects, such as drowsiness, dizziness, and impaired coordination, which can increase the risk of falls and accidents. Section 6. STILNOX and liver health. Important dosage adjustments. The liver plays a vital role in metabolizing or breaking down medications in the body. When the liver is impaired, it can't process medications as efficiently, leading to a buildup of the drug in the bloodstream. This is particularly important to consider with STILNOX, as it's primarily metabolized by the liver. For individuals with liver impairment, dosage adjustments are crucial to prevent potential complications. The starting dose of STILNOX is typically lower in this population, and careful monitoring is necessary to assess the medication's effects and make any necessary adjustments. It's essential to inform your doctor about any history of liver disease, including hepatitis, cirrhosis, or any other conditions that may affect liver function. They can then determine the safest and most effective dosage of STILNOX based on your individual circumstances. Section 7. Common side effects of STILNOX. What to expect. Like all medications, STILNOX can cause side effects, although not everyone experiences them. Most side effects are mild and tend to subside as your body adjusts to the medication. Some common side effects of STILNOX include drowsiness, dizziness, headache, diarrhea, and dry mouth. These side effects are typically mild and transient, resolving on their own as your body adapts to the medication. However, if any side effects persist or become bothersome, consult your doctor. They may suggest adjusting the dosage or exploring alternative treatment options. It's essential to be aware of these potential effects and discuss any concerns with your doctor. Your safety and well-being are paramount. Section 8. Recognizing and addressing serious side effects of STILNOX. While most side effects of STILNOX are mild, it's crucial to be aware of potential serious side effects that warrant immediate medical attention. These adverse reactions are rare, but can occur, particularly with higher doses or prolonged use. Serious side effects of STILNOX may include allergic reactions, unusual mood or behavioral changes, memory problems, and sleepwalking or other sleep-related behaviors. If you or someone you know experiences any of these serious side effects, seek immediate medical attention. Your safety and well-being are paramount. Prompt medical intervention is crucial in managing these adverse reactions effectively. Always stay informed and vigilant about your health. Section 9. Important precautions before taking STILNOX. Before starting STILNOX, it's essential to discuss your medical history and any existing conditions with your doctor to ensure it's a safe and appropriate medication for you. Certain conditions may increase the risk of side effects or make STILNOX less effective. Inform your doctor if you have any of the following: breathing problems, liver or kidney disease, history of mental health issues, alcohol or drug abuse. By providing your doctor with a comprehensive overview of your health history, including any medications or supplements you're currently taking, you empower them to make informed decisions about your treatment plan and minimize potential risks. Open communication is key to effective treatment. Your doctor can provide personalized advice and guidance based on your individual circumstances. Section 10. STILNOX interactions. Alcohol, medications, and more. STILNOX can interact with various substances, including alcohol, other medications, and even certain foods. These interactions can alter STILNOX's effectiveness and increase the risk of side effects. It's crucial to be aware of these potential interactions and discuss them with your doctor or pharmacist. Alcohol combining STILNOX with alcohol can be extremely dangerous. Both substances are central nervous system depressants, and their combined effects can lead to excessive sedation, respiratory depression, and even coma. Other sedatives. Taking STILNOX with other medications that cause drowsiness, such as antihistamines, muscle relaxants, or pain relievers, can intensify their sedative effects and increase the risk of side effects. Grapefruit juice. Grapefruit and grapefruit juice can interfere with the breakdown of STILNOX in the body, leading to higher blood levels of the medication and an increased risk of side effects. Always inform your doctor about all medications, over-the-counter drugs, supplements, and herbal remedies you're taking to prevent potential interactions. Section 11. STILNOX and special populations. Pregnancy, breastfeeding, and children. Certain populations, such as pregnant women, breastfeeding mothers, and children, require special considerations when it comes to STILNOX use. Pregnancy. There's limited data on the safety of STILNOX during pregnancy. It's essential to discuss the potential risks and benefits with your doctor if you're pregnant or planning to become pregnant. Breastfeeding. STILNOX can pass into breast milk and may harm a nursing infant. Consult your doctor to determine if alternative treatment options are available or if breastfeeding should be discontinued while taking STILNOX. Children. STILNOX is not approved for use in children. Always consult your healthcare provider before taking STILNOX if you fall into any of these categories.